Neck pain is a common health issue that affects many adults at some point in their lives. Neck pain can arise from a variety of causes, including, well, let's dive into some of the most common ones. Cervical muscle strain, or spasmodic torticollis, which are sudden, painful muscle contractions in the neck. Cervical spondylosis, an age-related wear and tear of the spinal discs and joints. Diffuse idiopathic skeletal hyperostosis, or DISH, a rare condition that leads to ligament and tissue stiffness. Fibromyalgia, a chronic disorder known for causing widespread muscle pain and fatigue. And herniated discs, where a disc slips out of place and presses on nearby nerves. Other causes include meningitis, a serious infection that affects the protective membranes of the brain and spinal cord. Muscle strain, often resulting from injury to the muscles or tendons. Myofascial pain syndrome, a chronic pain disorder that targets specific muscle points. Osteoarthritis, which involves gradual joint degeneration and cartilage breakdown. And poor posture, especially from prolonged sitting or excessive screen use. Additionally, there's rheumatoid arthritis, an autoimmune disease that can affect joints and even internal organs. Improper sleeping positions like using too many or too few pillows can also contribute. Spinal stenosis, which is the narrowing of the spinal canal that might compress nerves. Tension headaches, which are often accompanied by neck muscle tightness. Trauma or falls, such as car accidents or diving injuries, and finally whiplash injuries caused by sudden back and forth movement of the neck. Neck pain caused by mild strain or tension often resolves on its own within a few days. But, when the pain persists or worsens, further treatment may be necessary. Options include stretching exercises and physical therapy, therapeutic massage, medications or steroid injections, and in rare or severe cases, surgery. Seek emergency medical help if you experience trauma or injury, like from a car crash or fall. Muscle weakness, especially if it affects your arms or legs, or causes difficulty walking. Or if you have a high fever with neck pain, as this may indicate meningitis, a life-threatening infection. You should also contact a healthcare professional if your neck pain worsens despite self-care efforts, persists for more than a few weeks, spreads to your arms or legs, or is accompanied by symptoms like headache, numbness, weakness, or tingling. You can ease your neck discomfort by following these self-care techniques. Cold or heat therapy. Apply cold packs or a wrapped ice bag to your neck for up to 15 minutes several times a day during the first 48 hours. After 2 days, switch to heat therapy using a warm shower or a heating pad on a low setting. Gentle stretching. Slowly rotate your neck side to side and up and down. Be sure to avoid sudden or forceful movements. Massage therapy. A trained therapist can gently massage tight neck muscles, which can be especially helpful for chronic pain. Maintain good posture. Sit upright with proper back support. Position your computer screen at eye level and hold phones or tablets at eye level instead of bending your neck downward. Neck pain is often due to simple issues like muscle tension or poor posture, but in some cases it may signal a more serious health condition. Practicing good posture, doing light stretches, and using cold or heat therapy can significantly reduce discomfort. Don't hesitate to consult a doctor if your pain continues or is associated with other alarming symptoms.